Hi everyone, this is Smart Nursing YouTube channel, and today we're going to be introducing pharmacology. So in the previous video we talked about all Smart Nursing is about. So we decided to start with pharmacology because we cannot basically go into other videos without firstly introducing pharmacology, all what it's about. Because before we talk about any body system, at the end of discussing any body system, we have to discuss the drug effect to diseases, the effect of drug on different pathological conditions. So before we begin to talk about those kind of things, or before we go into that phase, we decided to start with pharmacology so that by the time we move into that, it will be way easier. So it's been quite difficult to talk about pharmacology without identifying what exactly pharmacology means. So pharmacology comes from two words. The first word is pharmacon and the second word is logos, which is literally the study of medicine. In time past, pharmacology was all about herbal remedies, plants, and how plants can be used to treat certain conditions. It is recorded that the Babylonians were the first to have these things recommended or these things documented. And Babylonians actually started with tablets. It was some clay tablets. Then we had if some people had tried out some plants and it worked for some conditions, then they would just write it down. Look, okay, we tried treating pain with some opium, with some opium plants, and it worked out. And then you see they would record these in a clay. So these were prescription clay tablets. So this was in 3000 BC. 300 years later, the Chinese had a compendium where they recorded different herbal remedies, and those herbal remedies where they all came back to it, just different herbal plants and how they work, and those were the second recognized history to drugs. Yes. So lastly, the Egyptians came up with the Ibis papyrus, and after that moment, there was different changes in the pharmacological world. That's when the first time we heard the word pharmacology was in a book called Materium Medicum, and that book was written by Samuel Dale in 1693. So people began to reference the word pharmacology and to know it as that what it meant was just the study of drug and all the effects of drug, how drug responded to the systems of literally every one of us. So after some time, different sciences began to try to test these drugs, to test them, how they worked on the body. Some tested them on themselves, some with animals on different bases. But somebody that was very, very notable was Frederick Santana. Frederick Santana was among the first to get the opium plant and extracted morphine from the opium plant. That was in 1805. And ever since then, people have been testing different drugs on plants to be able to find out what's the mode of action of this drug, how much does this drug, how much dosage is needed for a particular drug. And that was when a lot of chemists came together to try to analyze and to try to produce these drug compounds from plant remedies. Pharmacology finally became a discipline in the year 1847 from a university at the United States of America, and ever since then pharmacology has been recognized as one of the major disciplines, or rather major courses. And a new dawn, something I like to refer to as a new dawn, happened from the 20th century when people began to synthesize these drugs. Okay, they came together and found out that, okay, we cannot continue to produce these things from plant remedies. Why? Because plant remedies are scarce. Chemists came together to find out that we can now produce some drug compounds synthetically in the laboratory, and that started from the 20th century. Ever since the 20th century, a lot of developments have started to happen in the pharmaceutical world. Consider the amount of morphine compounds that we have available in trade names currently sold in several pharmaceuticals cannot be gotten from opium, because the opium is not necessarily enough to produce these things. It's worthy of note that pharmacology is not just about drugs. When you want to study pharmacology, you can't just limit it to okay, fine, just pharmacology, because it's a combination of several areas: anatomy, physiology, chemistry, microbiology, and parasitology. And you want to know how. And I gave an example with aminoglycosides. Aminoglycosides, which are very, very effective for infective carditis. Before a person is administered aminoglycoside, you would want to check Okay, extra dosages of aminoglycoside causes ear toxicity, and that has already taken us to the anatomy and physiology, because you want to consider the organ, the sense organs, the effects. It also causes muscle impairment when it's an overdosage. So when you check out this, you see that everything works together. And even from the word aminoglycoside, it's easy to see that chemically we can say that it's a combination of two words, amino and glycoside. And let's say amino and glycose, which from chemistry we can be able to tell that the roots form of these combinations. Another example is tetracycline. We cannot talk about tetracycline just individually as a drug without talking about the fact that it combines with calcium containing structures found in the body, like the teeth, and bones and stuff. That's why it's not recommended for pregnant women and young children, because it causes the yellowing of teeth. So you can see that from the pharmacological aspect, we're already talking about the anatomy and physiology of sense organs, of the mouth, of the teeth, and also we can look at that through microbiologically. When we want to look at tetracycline as an antibiotic, we would also check the fact that microbiologically there are two types of bacteria: the gram-positive and the gram-negative bacteria. The gram-positive and the gram-negative bacteria. So you see that pharmacology is not an island of its own. It is involved with several components. Alright, now we're going to look at the several ways we can group a drug. I'll start with the therapeutic or pharmacology classification. Now, when a drug is classified therapeutically, we're looking at it generally, the therapeutic effect of that drug generally. For example, when it comes to the heart as a whole, there are several drugs with several therapeutic effects. Now, when we talk about anticoagulants, we're talking about drugs that prevent clotting. And when we talk about antihypertensive, we're talking about reducing, it helps to reduce pressure, which is the blood pressure. But then when we mention pharmacological classification, we're talking about the individual aspect of that drug. For example, for antihypertensive, there are several types of antihypertensives. There is the diuretic, there are calcium blockers, and other types of pharmacological classification. But when we talk about antihypertensive, the diuretic has its own effect, helps to reduce the plasma volume. Same with the calcium blockers, the calcium channel blockers helps to block the calcium channels. They are all working for one therapeutic effect, which is what? Against hypertension. So you can see that one particular brand, then pharmacological classification would talk about individually what exactly does this drug do, what is the exact mode of action of this drug. So another form of classification you can see in pharmacology is the scheduled drugs. Now, these scheduled drugs are mostly controlled substances. Controlled substances are usually classified under 5 schedules. Now, for this first schedule, you have to know that it should not even be given at all, not administered. You cannot find heroin or LSD given administered or by prescription or administered for any reason. Though there are some places in the world like Mexico, Canada, that I heard that it's being administered with prescription. But over in the US and in some other countries, it is not administered. So if you look at Schedule 2 drugs, these drugs one thing you need to know about the scheduled drugs is that they have a tendency for someone to become dependent on them because of they have narcotic effects. Now, this Schedule 2 drug, it can actually be given by prescription, because although this drug already have a history of making people dependent on it, it also has its own therapeutic effects, and that's why morphine is administered for pain. But these Schedule 2 drugs can only be gotten with a one-time prescription, and it cannot be phoned. Like a doctor cannot phone in to a pharmacist and say, okay, I'm the doctor that sent this drug, give it to this patient. No, because it should only be filled, and the kind of form that is filled in is what they call the security security prescription forms. So you hardly get a Schedule 2 drugs to be administered on your own. Now, Schedule 3 drugs, this is usually a combination of narcotic drugs plus a non-narcotic drugs. And you already know Tylenol. What is Tylenol? Tylenol is basically acetaminophen, and some countries call it paracetamol, some countries call it Tylenol. Now there is a particular combination that has codeine and Tylenol together, and also uses prescription forms, but instead of the one-time prescription forms, you can continue the prescription, meaning that if I was prescribed this drug, I can come back again and get it with that same prescription form. But that's what makes it different from Schedule 2 drugs, because Schedule 2 drugs is a one-time prescription, and we go to Schedule 4 drugs. These are value-like drugs like Ambien, and this kind of drugs, it can be phoned in. What that means is that a doctor can call in to a pharmacist and say, okay, I have asked this patient to get this drug from you, and it will be given. Because as much as these drugs have some risk for narcotic effect of people becoming dependent on these drugs, it also is not so harmful. So these kind of drugs can be phoned in, and they do not need a security form, a security prescription form. It can just be gotten from a normal prescription form. Lastly, we're going to talk about the Schedule 5 drugs. This kind of drugs happen to have some form of narcotic ingredient, although initially it is not exactly a narcotic drug. Now, when we talk about Lomotil, it's already an anti-diarrheal agent. What that means is that it's a drug that is against diarrhea, prevents diarrhea, anti-diarrhea. But you already know that one of the effects of narcotic drugs is that it causes constipation. So you can already imagine that some form of raw materials that is used to create most of these narcotic drugs is also found in the this anti-diarrheal agent like Lomotil. So unless this kind of drugs can be administered just by a normal prescription, because before a patient can actually get dependent on this drug, it must be taken in excess. Same with Robitussin, and anywhere you see the word Tussin, it's talking about cough. This is mostly why you see that some cough syrup cause drowsiness. So this Robitussin rather. The meaning of this R here, wherever you see R, it is talking about trademark. It's talking about it's a trade drug. That means it's not a generic drug. Now we're going to talk about this generic and the trade. When a drug is developed by a pharmaceutical company, a right is given to that company that developed that drug to be the only group of companies producing it for at least 20 years. And the reason for that is so that they can recover the funds, obviously, because a lot of research goes into drug productions. When the first company that produced the drug usually identified the compounds that form the drug. For example, we have acetaminophen. So when you see acetaminophen, there are several things that come to your mind. To somebody that's not really advanced in pharmacology, you might not be able to identify this drug, forgetting that it's the same thing as Tylenol, because Tylenol is just one of the popular brands of companies that's produced this drug. Let's think about something. For example, you get a noodle, or some people call it ramen. And for a pack of noodle, there are several companies that produce a noodle pack. Now, instead of it to be called noodle, this noodle would be the generic name, because it is all centered around it. Just like you have several kind of companies producing different bathing soaps, at the end of the day, they are all soaps, right? But then you want to identify that, okay, this is a premium soap, this is different kind of soap. So it's the same thing that happens with acetaminophen. Every company producing these drugs already have these basic compounds that they put together to form these drugs. So the basic compounds mostly come together to form the generic name. And that is why when it comes to malaria drugs, we already know that we have artemether and lumefantrine together. But rather, when you go to get a anti-malaria medication, you'd rather see a company's name on it. Now, that company's name that you saw is called the trade name. while the other name, the basic name of the drug, is the generic name, the genesis, the origin of that drug. It is the first name. Then other companies produce drugs under the trade name of that same drug. So we've come to the end of genetic and trade name.